Anxiety disorder. The truth behind constant worry. Hey everyone, welcome back to the channel. Today, we're diving deep into something that affects millions of people worldwide. Something that you or someone you love might be experiencing right now. Anxiety disorder. Statistics show that approximately 4 to 5% of the world's population struggles with anxiety disorders, making it one of the most common mental health conditions globally. So what exactly is an anxiety disorder? How is it different from normal worry? And most importantly, how can we manage it? Let's explore together. First, let's get something straight. Feeling anxious is completely normal. It's a natural human response that's been hardwired into our brains for thousands of years. When our ancestors faced a predator or a life-threatening situation, anxiety triggered the famous fight-or-flight response, releasing adrenaline and preparing the body to either confront the danger or run away. This survival mechanism kept humanity alive. Even today, a healthy dose of anxiety before a job interview, an important exam, or a first date is perfectly normal. It keeps us alert, focused, and motivated. But here's where things get complicated. Anxiety disorder isn't just feeling nervous before a big presentation or worried about paying your bills. It's when that anxiety becomes excessive, persistent, and starts interfering with your daily life. It's when the alarm system in your brain gets stuck in the on position, constantly signaling danger, even when there's no real threat. Imagine living with a smoke detector that goes off every single day, multiple times a day, even when there's no fire. That's what anxiety disorder feels like for many people. There are several types of anxiety disorders, and it's important to understand that they're not all the same. The most common type is Generalized Anxiety Disorder, or GAD. People with GAD experience excessive worry about various aspects of life: work, health, family, finances. For at least 6 months, this worry is hard to control and often comes with physical symptoms like muscle tension, fatigue, difficulty concentrating, irritability, and sleep problems. It's like carrying a heavy backpack filled with worries everywhere you go, and you can't put it down. Then we have panic disorder, which involves recurrent, unexpected panic attacks. A panic attack is an intense surge of fear that peaks within minutes and includes symptoms like a racing heart, sweating, trembling, shortness of breath, chest pain, nausea, dizziness, and a feeling of losing control or dying. Many people experiencing their first panic attack rush to the emergency room, thinking they're having a heart attack. The scary part? These attacks can happen out of nowhere, even during sleep, which creates a fear of having another attack, a condition called anticipatory anxiety. Social anxiety disorder is another common form where people experience intense fear of social situations where they might be judged, embarrassed, or scrutinized by others. This isn't just shyness. We're talking about anxiety so severe that people might avoid social gatherings, public speaking, eating in front of others, or even making phone calls. In severe cases, this can lead to complete social isolation. We also have specific phobias, intense, irrational fears of specific objects or situations like heights, flying, spiders, needles, or enclosed spaces. While many people dislike these things, a phobia causes such extreme anxiety that people go to great lengths to avoid the feared object or situation, sometimes limiting their life significantly. Agoraphobia deserves special mention. This is the fear of being in situations where escape might be difficult or help unavailable if panic-like symptoms occur. People with agoraphobia might avoid crowded places, public transportation, open spaces, or even leaving their home. In extreme cases, individuals become completely housebound. So, what causes anxiety disorders? The truth is, there's no single cause. It's usually a combination of factors. Genetics play a role. If anxiety disorders run in your family, you're at higher risk. Brain chemistry is another factor. Neurotransmitters like serotonin, dopamine, and GABA regulate mood and anxiety, and imbalances in these chemicals can contribute to anxiety disorders. Life experiences significantly impact anxiety development. Traumatic events, chronic stress, childhood adversity, or even witnessing traumatic events can trigger anxiety disorders. Sometimes, medical conditions like heart disease, thyroid problems, or respiratory disorders can cause or worsen anxiety symptoms. Substance use, including caffeine, alcohol, and certain medications, can also trigger or exacerbate anxiety. Personality traits matter too. People who are naturally more prone to negative thinking, perfectionism, or who have low self-esteem may be more susceptible. Additionally, chronic stress from work, relationships, or financial problems can overwhelm coping mechanisms and lead to anxiety disorders. Now, let's talk about how anxiety affects the body. When you're anxious, your body releases stress hormones like cortisol and adrenaline. In the short term, this is fine. But chronic anxiety keeps these hormones elevated, leading to various physical problems. You might experience headaches, muscle tension, digestive issues like irritable bowel syndrome, weakened immune system, cardiovascular problems, and chronic fatigue. The mind-body connection is real, and anxiety doesn't just affect your mental state, it takes a toll on your entire body. The impact on daily life can be devastating. People with anxiety disorders might struggle at work or school, have difficulty maintaining relationships, avoid activities they once enjoyed, and experience reduced quality of life. The constant worry and physical symptoms are exhausting, leading many people to feel hopeless or depressed. In fact, anxiety and depression often occur together. But here's the good news: anxiety disorders are highly treatable. Treatment typically involves a combination of approaches, and what works varies from person to person. Cognitive behavioral therapy, or CBT, is considered the gold standard for treating anxiety disorders. CBT helps you identify and challenge negative thought patterns and beliefs that fuel anxiety. You learn practical skills to manage anxious thoughts and gradually face feared situations through exposure therapy. Exposure therapy, a component of CBT, involves gradually and systematically confronting feared situations or objects in a safe, controlled way. Over time, this reduces the anxiety response. It might sound scary, but it's done gradually, at your own pace, with a trained therapist guiding you. Acceptance and commitment. Therapy, or ACT, is another effective approach that teaches you to accept anxious thoughts and feelings rather than fighting them, while committing to actions aligned with your values. Mindfulness-based therapies incorporate meditation and mindfulness practices to help you stay present and reduce worry about the future. Medication can be helpful, especially when combined with therapy. Selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed antidepressants that help regulate brain chemistry. Benzodiazepines provide quick relief for acute anxiety, but are typically used short-term due to dependency risks. Beta blockers can help manage physical symptoms like rapid heartbeat, especially in performance anxiety situations. Beyond professional treatment, lifestyle changes make a significant difference. Regular exercise is incredibly effective. It reduces stress hormones, releases endorphins, and improves mood. Even a 30-minute walk daily can help. Quality sleep is crucial. Many since sleep deprivation worsens anxiety. Establish a consistent sleep schedule and create a relaxing bedtime routine. Nutrition matters more than you might think. Limit caffeine and alcohol. Eat a balanced diet rich in whole foods, omega-3 fatty acids, and nutrients that support brain health. Stay hydrated, as dehydration can increase anxiety symptoms. Stress management techniques are essential tools. Deep breathing exercises activate the parasympathetic nervous system, countering the stress response. Progressive muscle relaxation involves tensing and releasing muscle groups to reduce physical tension. Meditation and mindfulness help you observe anxious thoughts without judgment. Journaling allows you to process worries and identify patterns. Building a strong support system is vital. Connect with friends and family. Join support groups where you can share experiences with others who understand. And don't isolate yourself even when anxiety makes you want to withdraw. Social connection is a powerful buffer against anxiety. Time management and organization can reduce anxiety triggers. Break large tasks into smaller steps. Use planners or apps to stay organized. Set realistic goals and expectations, and learn to say no to avoid overcommitment. Let's address some common myths about anxiety disorders. Myth number 1. Anxiety is just stress, and you can just relax. Reality. Anxiety disorders are legitimate medical conditions involving brain chemistry and neural pathways. Telling someone to just relax is like telling someone with diabetes to just make more insulin. It doesn't work that way. Myth number 2. Anxiety disorders aren't serious. Reality. Untreated anxiety can lead to depression, substance abuse, physical health problems, and significantly impaired quality of life. They're very serious and deserve proper treatment. Myth number 3. Medication is the only solution. Reality. While medication helps many people, therapy and lifestyle changes are equally important and often more sustainable long-term. The best approach is usually comprehensive. Myth number 4. You'll have anxiety forever. Reality. With proper treatment, many people fully recover or learn to manage their symptoms effectively. Anxiety disorders are highly treatable. Myth number 5. Anxiety is a sign of weakness. Reality. Anxiety disorders result from complex biological, psychological, and environmental factors. They have nothing to do with personal weakness or character flaws. If you're watching this and recognizing these symptoms in yourself, please know you're not alone and help is available. The first step is reaching out to a mental health professional, a psychologist, psychiatrist, or licensed therapist who specializes in anxiety disorders. Your primary care doctor can also provide referrals and rule out medical causes for your symptoms. Many people hesitate to seek help due to stigma, fear, or believing they should handle it alone. But seeking help is a sign of strength, not weakness. You wouldn't hesitate to see a doctor for a broken leg. Mental health deserves the same attention and care. Early intervention makes a significant difference. The longer anxiety goes untreated, the more entrenched patterns become and the harder recovery can be. Don't wait until anxiety has completely taken over your life. If anxiety is interfering with your work, relationships, or daily activities, it's time to seek professional help. Remember, recovery isn't linear. There will be good days and challenging days. Progress might feel slow at times, but every small step forward counts. Celebrate your victories, no matter how small. Got through a social event you were dreading? That's huge. Managed a panic attack using breathing techniques? That's progress. Be patient and compassionate with yourself throughout this journey. For friends and family members of someone with an anxiety disorder, your support matters immensely. Educate yourself about anxiety to better understand what your loved one is experiencing. Listen without judgment when they want to talk. Avoid saying things like, "Just calm down," or "There's nothing to worry about." Instead, acknowledge their feelings and offer support. Encourage professional help, but don't force it. Be patient, as recovery takes time. And take care of your own mental health too. Supporting someone with anxiety can be emotionally taxing. In conclusion, anxiety disorders are common, real, and treatable. They're not a sign of weakness or something you need to just get over. With the right combination of professional treatment, lifestyle changes, and support, people with anxiety disorders can and do recover. They go on to live full, meaningful lives without being controlled by constant worry and fear. If this video resonated with you, please give it a thumbs up and share it with someone who might benefit. Subscribe to our channel for more mental health content, and drop a comment below, sharing your experiences or questions about anxiety. Remember, it's okay not to be okay, but it's not okay to suffer in silence. Reach out, get help, and know that brighter days are ahead. Thanks for watching, and I'll see you in the next video. Take care of yourselves.